My name is Patrick. That is my mom. That is my sister Emma. That is my dad. And that is my sister's friend Cammie.
My speech today is on why people should wear masks during the coronavirus. We're all struggling right now, whether we have family with underlying health conditions or we are small business owners who have to close up shop because people aren't going to their small business and creating a lack of orders, so they have to close up shop. We're all struggling. A lot of us are in isolation, which is really mentally challenging. But in regards to actual numbers, the state of Florida is not only the epicenter of the nation, but the epicenter of the world, largely in part to our lack of social distancing and refusal to wear masks. When people don't wear face masks, they obviously have a greater chance of getting and spreading the coronavirus. Obviously, wear a mask to prevent higher case numbers, illness, and death. If we all wore masks when going out into social settings, our numbers would fall drastically. First, I would like to discuss how not wearing a mask can further spread the coronavirus. Going out into public social settings without a mask increases that risk. By BBC.com, even wearing a damp homemade mask can reduce the number of droplets each of us emit while we speak, according to a study by researchers at the U.S. National Institute of Health in Maryland. If you don't have the funds to buy one off of online or in a store, make one yourself. You can make one out of a towel, out of cloth, or out of a t-shirt. Also by BBC.com, when an infected person coughs, they can send showers of tiny droplets known as aerosols filled with the virus into the air. A single cough can produce up to 3,000 droplets. Doesn't take many droplets to get sick, and that is 3,000 droplets you're spreading into the air if you're not wearing a mask. The coronavirus is obviously incredibly contagious. One of the reasons widespread public face mask wearing is so important with COVID-19 has to do with the prevalence of asymptomatic carriers who can still spread the virus to others. It is estimated from anywhere from 6% to almost 18% of those infected can carry the virus without developing symptoms. Add to this an incubation period of around 5 days, but up to 14 days in some cases, before symptoms develop, and even those who do go on to show signs of being contagious can spread the virus before they start themselves to feel ill. That was also by BBC.com. Also by BBC.com, together they suggest that in the right conditions, the virus can linger in the air for several hours and still infect people if breathed in. And in indoor environments, they seem to be particularly prone to spreading through the air. Outdoor environments are obviously better to be in with others, still wear a mask, but they're obviously better to be in with others because there is a ton of air outside, limitless air. In indoor environments, you have circulated air, which is continuously spreading your germs that you emit through coughing, speaking, or sneezing. The next thing I'd like to talk about is how wearing a mask affects others. Wearing a mask limits the exposure of the virus to others. By NPR.org, one study published in late May in BMG Global Health looked at people in households in Beijing where one person confirmed to have COVID-19. At the time, explains study co-author Rana McIntyre, research was already showing that the majority of transmission of the virus was happening inside households, and China had already a culture of mask wearing. Many people in China wear masks because they are, I wouldn't say germaphobes, but they are cautious of spreading germs. The study found that in households where everyone was wearing a face mask outdoors, a precaution before they knew anyone who lived there was sick, the risk of transmission was cut by 79%. China has the world's greatest population in one country. The United States is not nearly as many, and if we can look at China and look at their studies and how it's affected them positively, we can certainly bring it here. By greenmatters.com, in a White House press briefing this week, Task Force Response Coordinator Dr. Deborah Birx explained that cloth masks should be viewed as an additive piece on top of the social distancing and hygiene measures that have already been recommended. Additionally, getting Americans to cover their faces with cloth masks will hopefully free up more medical-grade masks for more healthcare workers. No one needs an N95 mask that is sitting at home or going to the grocery store unless you have an underlying health condition. These are for people who are in assisted living places, nursing homes, or in hospital settings. Wearing the mask allows you to be respectful for others' lives. By Forbes.com, wearing a mask tells the person you pass on the street, share an aisle with in the supermarket, or march alongside at a peaceful protest, that you respect them as a fellow human. No one knows who you're passing on the street and what their lives look like in closed doors, so be respectful of that. By MSN.com, but mask mandate's purpose is not to suppress political expression, but to hinder COVID-19. And the Supreme Court has held for more than 50 years that when a law indirectly restricts expression by targeting conduct, it is constitutional so long as it is substantially related to an important government interest. I would like to now discuss the future of mask wearing. Small businesses have been created to make cloth masks for average citizens by greenmatters.com, but if you'd rather purchase one and support a small business in the process, we've compiled a list of 10 small businesses making and selling cloth masks online. Plus, most of the business on this list are using the proceeds from selling masks to make and donate as many masks as they can to healthcare professionals. So not only are you buying a mask to protect yourself, not using an N95 when you don't need to, but you're also helping healthcare workers financially. Also by greenmatters.com, again, the masks on the following list are not medical grade, but even if they do not work perfectly, cloth masks or basic surgical masks combined with social distancing and proper hygiene are still better than no mask at all in many instances. Numbers will also drop exponentially. New Jersey, by bestoflifeonline.com, New Jersey was the first state to issue a face covering order way back on April 8th. By the beginning of May, cases began to drop drastically in the state and have been on a steady decline since, reporting as few as 90 new cases on June 29th compared to 4,287 on April 16th. Also by bestoflifeonline.com, on April 4th, New York reported 12,274 new cases, the majority of which were concentrated in New York City. However, now they have 391 cases on June 20, as reported on June 29th, a fraction of its cases 2 months ago after their mask mandate. So, to summarize, facial coverings are crucial to wear appropriately during the coronavirus pandemic. I encourage each and every one of you to not only wear the face mask, but to wear them properly. And it is our duty to take action ourselves when the government does not. And when your local and state government do mandate mask wearing, follow their guidelines. Your respect will save lives. Thank you.